So, good afternoon, sir. Today, I'll be performing the Integumentary System assessment. So, good afternoon, sir. I am your student nurse for today. My name is Jonna Isabel Guno. So, for today, I'll be going to assess your skin, hair and scalp, and your nails. So, first, I will going to assess for the skin. So, I will inspect the skin to generalize the color. So, the color of the skin of patient is brown. It indicates a normal color. So next, I'll be going to inspect the skin to localize any variation, if there is any presence of vitiligo, freckles, stretch marks, and melanoma, and also the albinism. So far, the skin of the patient is there are no presence of any variations. So next, I'll be palpating for the skin to assess for the texture. I will use the palmar surface of my hand and the finger pads. So the texture of the skin of patient is smooth and soft. So next, I'll be going to palpate their skin for moisture and temperature. So in this, I'm going to use the dorsal surface of my hand. So the moisture and temperature of patient is normal. So next, I'll be going to palpate for the skin mobility or turgor. I will slightly pinch the skin under the clavicle of the patient using a thumb and my forefinger. So the normal finding, if you release your hand in the skin of the patient, it will go back to its normal position. So next, I'll be inspect and palpate for skin lesions. So there is no presence of skin lesions. So next, I'll be palpating the skin to detect the edema. I will use my thumb to press down on the skin of the ankle and be able to grade the edema on a 4-point scale, the +1, 2+, 3+, and 4+. For +1, it indicates a mild edema, and for +4, it indicates a deep edema. So sir, I am going to check your ankle if there is any presence of edema. So the patient has a +1 edema. It disappears rapidly in a few seconds or in 1 second. So sir, for the next assessment, I will going to assess your scalp and your hair. So first, I will ask the client to remove any hairpins, wigs, or hair pieces, and I will part your hair, sir, in 1-inch interval. So there is no hairpins naman. So next is I'll be inspect and palpate the scalp of patient to check the hair color and the surface and characteristics, and also for the hair distribution. So for the hair color, the color of the hair of patient is black. Then the scalp is white, which is normal. And the surface and characteristics and the quantity is normal. And the hair distribution of patient is normal. So there is no presence of uban or white hair. So next, I'll be inspect for your hair texture. I will roll a few strands in between in my thumb and forefinger. So far, when I roll the hair of the patient, there is no a falling hair. So the hair of patient is healthy. So next, I'll be inspect for the facial and body hair for distribution, quantity, and texture. So the pubic hair of patient is not included. It is a optional because it is a private part. So the patient has a mustache and borangos. So next, for the hair and scalp assessment, I will inspect the scalp if there is any lesions. So far, the scalp of patient is no presence of lesions. So the next assessment or the last assessment in integumentary system, I will assess for the nails of patient. So first, I will inspect the nails for grooming and cleanliness. So I will put some alcohol. So I will inspect for grooming and cleanliness of the nails. So the nails of patient is clean. So next, I'll be inspect for the color and thickness. So the color of the nails of patient is pink. So next, I'll be inspect for the nail surface to determine its smoothness. And I will note for the grooves, depressions, and pitting and ridges. So far, there is no presence of grooves, depressions, pitting, and ridges, and it is a smooth. So next, I'll be inspect and palpate for the nails for shape and contour. So next, I'll be inspect the nail base angle. So the nail base angle of patient is 160 degrees, which is normal. And I will also check for the base angle of nail fold and nail plate. So next, I'll be assessed for the nails for nail clubbing by performing a scalp froth test. So sir, So next, I'll be assessing for the nails for nail clubbing by performing a scalp froth test. So sir, pwede mo siya sundon akong kamot nga gaamo niya ang. So far, the patient's nails has a diamond space, which is normal. So next, I'll be performing the capillary nail refill test. So the rationale of this, for the capillary refill, the normal color will go back to the normal color not less than 2 seconds. So far, the assessment in the nails of patient is normal. There is no presence of nail clubbing or any lesions. So, sir, I am done now with the integumentary system of assessment of the patient. The patient has a normal findings in the hair, scalp, nails, and the skin. Thank you.